Hi, I'm Dr. Uday Sabarwal. In this video, we will be talking about how to do continuous simple suture. So in this video, we will learn about a continuous simple suturing. So the first suture is a simple interrupted suture. We start with a simple interrupted suture, going back to our basics. We tie the knot, as you can see here. And we cut only the short thread. तो अगर हम यहाँ दोनों threads cut कर देते हैं, it would have been a simple interrupted suture. उसके बाद we take 2 bites. Try to be equidistant. Okay. So the purpose of simple continuous suture is basically a series of stitches made around a long linear cut or wound, which can be in cases of periodontal surgery being done on the palate or an oral surgery being done on the buccal mucosa or palate. And instead of tying each stitch individually, the suture runs along the length of the wound with knots only at the beginning and end. So जैसे हमने initial एक knot लगाई, हम last में एक और knot लगाएंगे. It is preferred when rapid closure of a long wound is required. तो advantage सबसे ज़्यादा इसकी यही रहती है कि when it is done correctly, it allows for faster wound closure in comparison to simple interrupted sutures, क्योंकि हर एक को individual knot नहीं करनी पड़ी, and even tension is distributed along the wound edges. But we must understand that a potential risk is there that if the suture breaks at any point, then the entire suture line can loosen. जब हम लास्ट सूचर प्लेस कर रहे हैं तो ये जो नॉट है इसको छोड़ के ही हम यहाँ पे फाइनल अपनी नॉटिंग कर रहे हैं, as you can see here. Once we have done the final knotting, we can cut the thread. Even the knotted part of the thread can be cut, but here I have shown you that additional knot. So with that, we finish our video on simple continuous suturing. To watch any of our previous videos, please click on the playlist link provided here. To watch our next video on continuous locked suturing, please click on the link provided here. Thank you.